Have you ever wondered how doctors can spot serious health issues just by looking at the way you take care of yourself? Most people think personal hygiene is all about looking neat or smelling fresh. But the truth is the little habits you keep or skip can send instant signals to your doctor about your health, energy, and even your independence. If you're over 60 or want to age with confidence, it's time to look closely at the hygiene mistakes that doctors notice right away. In this video, we'll uncover 7 personal hygiene mistakes that seniors often make. Sometimes out of habit, sometimes out of struggle, that alert doctors to deeper health concerns. Each sign is more than just a cosmetic issue. It's a window into how your body is coping with age, illness, or even stress. Stay tuned until the end because the last mistake is one hardly anyone talks about, but it can make all the difference for your health and self-esteem. I'll walk you through each mistake, explain why it matters, and share practical ways you can avoid these pitfalls so you not only look your best, but also protect your health and your dignity. Let's get started. Number 1. Neglecting oral hygiene and dental care. One of the first things any doctor or nurse will notice about a senior's health is the condition of their mouth. Neglecting oral hygiene, whether it's skipping brushing, not cleaning dentures, or avoiding dental visits, shows up fast and sends an instant signal that something's not right. What most people don't realize is that your mouth is like a window to the rest of your body. If you let it slide, it's not just your teeth at risk, but your heart, your memory, and your immune system too. I've seen it time and again. Older adults who feel tired or struggle with arthritis may find it harder to brush and floss thoroughly. Some figure that dentures mean they don't have to worry as much. But nothing could be further from the truth. Failing to clean your dentures or natural teeth leads to plaque, gum infections, and even sores that make eating painful. The end result: trouble chewing, weight loss, and sometimes even withdrawal from social gatherings because of embarrassment or discomfort. But it doesn't stop there. Poor oral hygiene allows bacteria to enter your bloodstream, increasing the risk of heart disease, strokes, and even worsening diabetes. Your doctor can spot signs of dry mouth, bleeding gums, or foul breath the moment you sit down, and those are often clues that something deeper is going on. Sometimes persistent mouth problems are the first hint of neglected self-care or early memory loss. Take the story of Tom, age 77, who stopped seeing his dentist after he moved across town. At first, he figured it didn't matter until his daughter noticed he was eating less and his doctor picked up on the odor from his breath. With some help and a return to daily brushing, Tom regained his appetite and energy and even started smiling more in family photos. The psychology here is powerful. Neglecting oral hygiene can be a sign that someone is feeling down, overwhelmed, or less motivated than usual. Reclaiming the habit is about more than just fresh breath. It's about regaining control, confidence, and a sense of pride. Taking 5 minutes morning and night for your mouth can make all the difference. Not just for how you look, but for how you feel and function each day. Number 2. Ignoring skincare and overlooking subtle changes. For many seniors, skincare becomes an afterthought, especially if they spent years working outdoors or have never been in the habit of using lotions or checking for changes. But to a doctor, the condition of your skin speaks volumes about your hydration, nutrition, circulation, and even your ability to care for yourself at home. Failing to pay attention to your skin doesn't just make you look older. It can quietly warn doctors that you might be struggling with bigger health issues. Dry, flaky, or irritated skin is a red flag that your body isn't getting the moisture or nutrients it needs. It can also signal that you may not be drinking enough water or that you're missing out on healthy fats and vitamins in your diet. Doctors are quick to spot pressure sores, bruises, or infections, especially on your feet, legs, or back that can develop if you're sitting or lying down too much. These changes can point to limited mobility, pain, or even depression that keeps you from staying active and connected. Then there are subtle warning signs like slow healing cuts, unusual rashes, or changes in skin color. Doctors notice these right away because they can indicate diabetes, poor circulation, or issues with your immune system. I once knew a woman named Virginia, age 82, who always wore long sleeves and never mentioned that her shins itched constantly. When her doctor saw the dry, cracked skin during an exam, he uncovered undiagnosed diabetes that had been creeping up for years. Neglecting your skin can also reflect how you're feeling inside. When people feel lonely, discouraged, or overwhelmed, they often stop caring for their appearance. It's easy to skip the lotion, ignore a new bruise, or delay calling the doctor about a sore. But these small acts of neglect add up, signaling to your healthcare provider that you may need extra support or encouragement. The good news is skincare doesn't need to be complicated. Making a habit of inspecting your skin, using gentle moisturizer, and keeping up with basic hygiene can go a long way in protecting your health and dignity. It's about self-respect and showing yourself and your loved ones that you still value your own well-being. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 3. Overlooking cleanliness of hair and scalp. For many older adults, keeping up with hair care can slip down the list of daily priorities, especially if mobility, arthritis, or fatigue makes washing and styling more of a chore. But when doctors examine a patient, they immediately take note of the condition of their hair and scalp. Oily, matted, or unkempt hair, flakes on the shoulders, or signs of sous and itching often reveal far more than meets the eye. Neglecting hair and scalp hygiene can be one of the first signs that someone is struggling at home. Maybe standing in the shower is difficult, or perhaps reaching up to rinse thoroughly just isn't as easy as it used to be. Sometimes seniors avoid hair washing altogether for fear of slipping or falling. The result of buildup of oils, dandruff, and sometimes even skin infections that doctors spot right away. Doctors are trained to observe these clues because poor hair hygiene often correlates with other lapses in self-care, such as forgetting to take medications, skipping meals, or missing important appointments. In some cases, a dirty scalp can indicate the early stages of cognitive decline, depression, or the simple fact that someone may need more help than they're letting on. I recall the story of Harold, Ed 75, who was always meticulous about his appearance. When his daughter noticed he was wearing a hat more often and that his hair looked greasy, she mentioned it to his doctor. After a gentle conversation, Harold admitted that showering felt unsafe. After a recent fall, with some simple home adjustments and support, he regained both his confidence and his clean, healthy scalp. Taking care of your hair isn't just about looking sharp for the mirror or a family gathering. It's a daily act of self-respect. A small but powerful way to tell yourself and your health team that you're invested in your own well-being. Even if you don't have much hair left, washing your scalp regularly and checking for irritation is just as important. Beyond appearance, this simple habit also lowers your risk of scalp infections, controls dandruff, and boosts your self-esteem. For seniors living alone, reaching out for help with hair care, whether from family, friends, or a visiting nurse, can be the first step toward a healthier, more connected daily routine. Number 4. Forgetting to maintain fingernails and toenails. The condition of your nails might seem minor compared to other health concerns, but for doctors, untrimmed or dirty. Fingernails and toenails are a big red flag. Overgrown, discolored, or thickened nails tell a silent story about your overall health, mobility, and even your risk for serious infections. In fact, some of the earliest signs of trouble, like diabetes, poor circulation, or fungal infections, show up right at your fingertips or toes. Many seniors struggle with nail care as eyesight fades, hands become less steady, or it gets tougher to bend down and reach their feet. It's easy to skip trimming or to overlook small changes like yellowing, cracks, or swelling around the nail beds, but these details jump out to doctors and nurses. Neglected toenails, in particular, can lead to painful ingrown nails, difficulty walking, or infections that quietly escalate if not caught early. Doctors also know that long or dirty nails can harbor harmful bacteria, increasing the risk of passing germs into your mouth or onto wounds. In some cases, nails become so thick or curved that they make simple tasks like buttoning a shirt or putting on shoes uncomfortable or even unsafe. Nail neglect can also reflect how confident and motivated you feel. When self-esteem is low or depression sets in, personal grooming is often the first thing to slip. I remember a neighbor named Dorothy, 80, who loved gardening but found her toenails too tough to manage. When her doctor noticed her limping at an appointment, a quick check revealed not only ingrown nails, but a fungal infection that was making her uncomfortable all day. After getting some help and building a routine for nail care, Dorothy was able to walk, socialize, and get back to her daily joys without pain or embarrassment. Keeping nails clean and trimmed isn't just about appearances. It's about protecting your independence, your comfort, and your dignity. Asking for help with nail care or even treating yourself to an occasional professional. Trim can prevent a host of problems and help you keep moving confidently through your days. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 5. Overlooking regular changes of clothes and laundry. For older adults, keeping up with laundry and regularly changing clothes can become a challenge, especially for those living alone, dealing with mobility issues, or simply feeling unmotivated. But when a senior comes to a doctor's appointment wearing the same outfit multiple times in a row, or with clothing that is soiled, wrinkled, or smells musty, healthcare providers immediately take note. These subtle signals can speak volumes about what's happening behind closed doors. Wearing the same clothes day after day may start as an innocent habit. Maybe you're comfortable in your favorite shirt, or maybe you don't want to run the washer for just a few items. But to a trained eye, it can indicate struggles with physical stamina, memory, or depression. Dirty clothing can harbor bacteria, irritate your skin, and contribute to unpleasant odors, which your doctor will quickly notice. Sometimes this is the first clue that a senior is losing interest in self-care or having trouble managing day-to-day tasks. More than just comfort, regularly changing clothes is a way to protect yourself from skin infections, rashes, and pressure sores, especially if you spend long periods sitting or lying down. Doctors will also check if you're wearing weather-appropriate clothing. Wearing heavy sweaters in summer or light shirts in winter can suggest issues with memory or body temperature control. I recall the story of Charles, 79, who started wearing the same flannel shirt week after week. His daughter noticed, and when she asked, Charles admitted that lifting laundry baskets up and down the stairs felt impossible after a recent injury. With a little help, rearranging his laundry setup and switching to lighter loads, Charles found it easier to keep up with changing clothes and felt better about himself every day. The habit of freshening up your wardrobe isn't just about how others see you, it's about how you see yourself. Clean clothes bring a sense of renewal, dignity, and readiness to face the world, no matter your age. Even small changes like having easy-to-wear outfits or asking for help with laundry can make a world of difference for your health and confidence. Number 6. Missing daily washing of hidden or sensitive areas. While most people remember to wash their hands and face, it's easy to overlook some of the hidden or sensitive areas that need daily attention. Doctors, however, are quick to notice signs that these spots are being neglected. Behind the ears, under the breasts, between skin folds, the groin area, and even the spaces between toes. These are places where bacteria, yeast, and sweat can build up without regular washing, leading to rashes, odors, or serious infections. As we age, changes in mobility, vision, or flexibility can make it harder to clean these areas thoroughly. Sometimes seniors feel shy about asking for help or simply don't realize that missing these spots can quickly become a health risk. Doctors and nurses check for redness, swelling, or sores in these spots because problems here can escalate fast, especially for anyone with diabetes, incontinence, or who spends much of the day sitting. Skin breakdown, fungal infections, and even bed sores often start in places people don't think to clean each day. A doctor might spot irritation under the arms or under a belly fold and know immediately that bathing routines need an update. The same goes for the scalp under hairpieces, under dentures, or around medical devices. When these areas are not kept clean, it puts your entire health at risk. I remember a friend named Lillian, 83, who started getting uncomfortable itching under her bra line and thought it was just part of getting older. Her doctor quickly saw it was a yeast infection caused by trapped moisture. And with some simple changes in hygiene and routine, Lillian was comfortable again. Staying healthy and independent is about paying attention to every part of your body, even those spots no one else sees. Regularly cleaning these hidden areas using gentle soap and drying carefully helps protect your skin, reduce risk of infections, and lets your doctor see that you're invested in your own care. If you're still watching this video and finding these insights valuable, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 7. Overlooking scent and breath as warning signs. One of the most sensitive yet important clues doctors notice the moment you enter their office is your natural scent and breath. While everyone worries about body odor from time to time, persistent smells like sour, fruity, or musty odors often tell a much deeper story about your health and hygiene habits. The same is true for chronic bad breath, which can reveal hidden problems far beyond what a mint or mouthwash can cover. Many older adults become used to certain smells or may not notice gradual changes over time. Dry mouth, certain medications, and medical conditions like diabetes or liver disease can change your natural scent without you realizing it. Sometimes a buildup of sweat or unwashed clothing can cause musty odors that linger in the home and on the body. Doctors are trained to notice these subtle cues because they can point to dehydration, infection, or even malnutrition. Breath in particular is a powerful indicator of your health. A sweet or fruity smell can indicate high blood sugar, while a strong ammonia scent might suggest kidney trouble. Chronic bad breath can signal gum disease, digestive issues, or even pneumonia in seniors who may not be eating or hydrating well. Doctors pay close attention because these signs are often overlooked until they become severe. I remember Walter, age 81, who was always embarrassed at his regular checkups about his breath. It turned out that he was drinking very little water and had untreated gum disease. With support from his doctor in a new oral hygiene routine, not only did his breath improve, but so did his appetite and energy. The truth is, your scent and breath are like a health report card. Keeping up with daily bathing, wearing clean clothes, staying hydrated, and seeing your dentist regularly are the best ways to keep things fresh. If you ever notice a new or unusual odor that doesn't go away, it's always worth bringing it up with your doctor because your body is sending you a message that shouldn't be ignored. Attending to these small details is about more than manners. It's a sign of self-respect, and it shows your health team that you are engaged in your own well-being. Sometimes catching a change in scent or breath early can help you prevent bigger health problems down the road. Final thoughts. Growing older with strength and dignity isn't about perfection. It's about paying attention to the little things that truly matter. Personal hygiene may seem small, but as you've seen today, it is a powerful mirror of your health, your independence, and your confidence. Each of these 7 mistakes is more than just a cosmetic issue. They are warning signs your doctor notices instantly. And by correcting them, you're not only protecting your body, but also preserving your self-respect and the way you engage with the world. Remember, every small step counts. Whether it's brushing your teeth, moisturizing your skin, trimming your nails, or making sure your clothes are fresh and clean, these habits send a message to yourself and to others that you are still in charge of your own life. Don't let these simple routines slip away because they can make the difference between merely getting by and truly living with vitality. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.